And doctor, something that really stood out to me, also to my producers, she says she is undergoing preventative chemotherapy. As someone who is currently undergoing chemotherapy, I'm wondering, does that likely mean the cancer appears to have been removed during surgery, and then her physicians are likely having her undergo chemotherapy to try to ensure that it does not return?
It was an interesting
Yeah.
terminology, and I think you're absolutely correct in that the mass was removed, but the chemotherapy is to maybe ensure that there's not a spread of cells to other areas of her body, including lymph nodes. Again, presumably, if this were an incidental finding of which she was asymptomatic, meaning she had no symptoms at all, and it was just discovered while she was there for something else, generally that has a good prognosis because it was caught very, very early. What we don't know is why she went in for surgery, and she seems to imply that there was an issue, and she had a fairly large surgery, and perhaps they were hoping that it would not be cancer and discovered indeed it was. So that's also another scenario because this abdominal surgery is also secretive, but she did seem to imply that it was quite a big surgery. So there was something that was concerning.
And Dr. Morgan, I think it's important just to kind of explain some of the basics of cancer treatment, because I think unless you've gone through it, you're going through it, or you have a loved one, we sometimes can hear these words and not necessarily know exactly what they mean. So a lot of times people get chemotherapy confused with radiation. They're two very different things.
Right.
Just kind of talk
That's right.
about, the process, what chemotherapy treatment and infusions really are.
And chemotherapy treatments generally are the types of infusions and medical treatments, they are considered medical treatments that target generally broad areas of cancer cells throughout your body. And the point is to not only kill the cancer cells, but to also prevent spread to other areas of your body, including other organs. That being said, we also don't know from Kate's very minimal disclosure with regard to whether or not what was discovered was part of something else that's elsewhere in her body, and the chemo may be targeting that. We just aren't sure. We know it's involving the abdominal area, which is a little bit of a vague term again, that people use outside of medicine to mean any number of things. And so we'll just have to wait and see if they disclose anything further. But chemotherapy is directed at the cancer cells and the cancer itself.
And my last question for you, Dr. Morgan. We know Princess Kate is 42 years old. And, I'm sure no matter what age a person is, when they hear the news, it is shocking. It is absolutely
Mhm.
shocking. But so many times people think, well, I can't get cancer. I'm only in my 40s, or I'm healthy, I eat well, I exercise. But this really shows cancer can affect anyone.
Not only can it affect anyone, she is a great example. And of course, I'm speaking without knowing her genetic history. Genetics play a really big role. I do not know her genetic family history. But you are right. This is a very unfortunate diagnosis as well, although we do not know what the prognosis is. But we are seeing, certainly here in the United States, younger and younger and younger people being diagnosed with cancers. And we have to begin to take a closer look at why that is. Cancer rates are decreasing in older people over the age of 70, while they're increasing in the younger demographic. Generally, we think that is connected to obesity and this chronic inflammation state that the body is in that can be very toxic. But we also see people like Kate and others, especially with colon cancer, that are very lean and having these diagnoses of colon cancer very young. Again, I'm not saying that she has colon cancer, but I'm just giving an overall viewpoint of what we are seeing here in the United States with a younger and younger demographic, similar to Princess Kate, with these increasing diagnoses of cancer.
Absolutely. And I certainly applaud Princess Kate for her bravery, because it is not easy to
It is
share
not
that
easy.
diagnosis with the public.